Dr. Bisa?
Yes, okay. It's okay.
No, I'd like to say it in the right way. Bija? Bija?
B.S. Jha, but you can say only Jha.
Cha. Okay. We are going to start soon.
Okay.
Okay, Bismillah ar-Rahman ar-Rahim. The first case will be presented by Dr. Muhammad Fathallah.
ماشي يا دكتور صالح حضرتك انت دايما في وش المدفع انت على
Because you are our boss was going for the exam.
اتفضل يا باشا قول. Any case.
Second case will be by Dr. Bisha. And okay.
Okay.
This is a case of history taking. Mr. Ahmed is 47 years old. He is known case of rheumatoid arthritis for the last 5 years. And he has been complaining of cough and shortness of breath for the last 2 months. Please take detailed history. You are senior house officer of the medical department in the outpatient clinic today, and you have this letter from the GP.
ماشي نبدأ يا دكتور صادق.
Okay.
Good evening Mr. Ahmed.
Good evening, doctor.
I am Dr. Muhammad, senior house officer at the medical department. First, it is nice to meet you.
Nice to meet you, doctor.
Secondly, I confirm that you are Mr. Ahmed, 47 years old. This is true?
Yes, doctor.
Are you ready to discuss your medical problem today?
Yes, doctor, I'm coming for that. My GP sent me for you for this problem.
Okay. So, in your GP letter that you're having a rheumatoid arthritis 5 years back. Can you tell me more about this?
He has been diagnosed to have this disease 5 years back, for which I'm following up with a rheumatologist doctor who's giving me some medication which is controlling my condition.
So, can you know the names of this medication?
Yes, doctor, I have this drug which is called methotrexate, 5 milligram once weekly, which is followed by folic acid 5 milligram. And also, I'm taking steroid from time to time, short courses of steroid, doctor.
I'm sorry for that, Mr. Ahmed. What about your rheumatoid arthritis? Did you have any recent pain in your hand?
No, doctor. My disease is controlled for the last 2 years actually on these medications.
Okay, this is good news. Also, I received from your GP letter that you complaining from cough and shortness of breath for the 2 months. Can you tell me more about this?
Yes, doctor, I have this shortness of breath and the cough for the last 2 months, doctor, which is irritating me so much.
About cough, Mr. Ahmed, it is dry or with phlegm?
No, it's dry, doctor.
It is morning more or evening more?
No, it doesn't varies with time, doctor. It can come anytime.
Did you observe something increasing your cough? Like your shortness of breath?
I have shortness of breath associated with cough sometimes, doctor.
Okay. So this cough relieved spontaneously or anything relieving it?
No, doctor, I tried many medication, but it doesn't work with it.
It is associated with noisy breathing?
No, doctor, there is no noisy breathing.
Okay. It is increased when you are exposed to cold, to perfumes, to dust?
I don't think so, doctor.
Did you have any history of asthma before?
No, doctor.
Can you tell me more about your shortness of breath, Mr. Ahmed?
Yes, doctor, the shortness of breath come to me most of the time, with me actually.
Okay. It is related to walking or exercise?
No, doctor, it can come in rest time.
Okay. Did you sleep flat, or you need to elevate the pillow?
No, doctor, it's okay. I can sleep flat.
Did you wake up from your sleep with shortness of breath or cough?
No, doctor. No, doctor.
Okay. Did you have any leg swelling, Mr. Ahmed?
Leg swelling? No, doctor. Leg swelling?
Okay. Did you have any chest pain?
No chest pain, doctor.
Any racing of your heart?
No racing of the heart, doctor.
السلام عليكم.
وعليكم السلام ورحمة الله.
Okay, Mr. Ahmed. Did you have any heartburn, Mr. Ahmed?
No, doctor.
Any acid brush during, especially evening?
No, doctor.
Is your cough become more after heavy meals?
No, doctor. It doesn't relate it to meals.
Okay, Mr. Ahmed. And you don't wake up with the choking from your sleep?
No. No.
Okay. So, Mr. Ahmed, for how long you take this drug called methotrexate?
For the last 2 years, doctor.
2 years. Did you observe that you have any shortness of breath after you start this medicine?
No, doctor.
Okay. And also you take intermittent course of steroids from time to time. Did you observe your shortness of breath improving with this steroid?
No, doctor.
Okay. Mr. Ahmed, did you observe any bluish discoloration of your tongue?
No, doctor.
Or in your hands?
No.
Okay, Mr. Ahmed. Can you tell me more, Mr. Ahmed, about your water work? Is there any change of your water work
No,
as
doctor.
regards the amount or the color?
No. No.
Or it is approaching more at morning?
No, doctor.
Okay. Did you complain from any tiredness, Mr. Ahmed?
Yes, doctor, since the start of this disease, rheumatoid arthritis, I'm complaining of tiredness, generalized tiredness, but I can manage. And after taking this methotrexate, my condition is stabilized now, and it's okay.
Okay. Did your follow your rheumatology complete blood count recently?
No, I don't remember, doctor.
He don't tell you that you have anemia or something like this?
I'm not sure about that, doctor.
Okay, Mr. Ahmed. Headache, Mr. Ahmed?
No.
Any blackouts or funny turns?
No.
Any unsteadiness?
No.
Any needles in your hands or leg?
Any what?
Pins or needles?
No.
Okay. Did you have any tummy pain, Mr. Ahmed?
No, doctor.
Any change in your bowel habits?
No.
Any difficulty of swallowing?
No.
Are you getting sick or feeling sick?
No.
Okay. Any redness or soreness of your eyes?
No, doctor.
Any soreness of your mouth?
No.
Any muscle aches or pain?
No.
Any skin rash?
No.
Any backache?
No.
Any change in the color of your hand?
No.
Okay, Mr. Ahmed. Are you a smoker, Mr. Ahmed?
Long time before, doctor.
For how long
I
you
stopped
was
smoking
smoker,
5 years back. I smoked 14 years, but I stopped smoking 5 years back when this condition started with me.
This is good, Mr. Ahmed. What about alcohol, Mr. Ahmed?
I don't drink, doctor.
Did you have any recent history of traveling abroad?
No, doctor.
Did you have any recent history of leg swelling in your calf, in the back of your leg?
No.
Any family
2
history
minutes
of
remaining.
blood clot? So, what's your
No.
concern, Mr. Ahmed?
I'm
What
concerned
is your
about
concern?
this short breath and the cough, doctor. What could be the cause?
Actually, Mr. Ahmed, there is many causes for your cough and shortness of breath. Okay, and one of it is related to your disease, rheumatoid arthritis. Sometimes it cause there is some narrowing of your air pipes in your lung. Okay, and this condition associated with your original disease. But first, I should admit you and carry some blood test and some imaging, and some blowing test, and after confirming my diagnosis, I will give you a feedback about this. This is okay for you, Mr. Ahmed?
Yes, doctor. So this cough and short breath is related to my rheumatoid arthritis, doctor.
This is the most likely cause after I discuss this issue with you, but I want to examine you as I tell you and admit you and carry some investigation to confirm my diagnosis and to exclude the other possibilities for your cough and your shortness of breath.
Yes.
Okay? But I want to ask you about your job, Mr. Ahmed. What about your job?
Yes, I'm an engineer, doctor. I'm exposed most of the time to dust and to pollens. So what do you think, doctor? Is it related to my work?
Did you observe that when you get away from your job, your cough and shortness of breath improving?
I'm not sure, doctor, because most of the time the shortness of breath and the cough with me.
Actually, Mr. Ahmed, as I tell you, this cough and shortness of breath is related to your disease, rheumatoid arthritis, because this disease is not affecting the joint only. It can affect the other system in your body, including your chest, okay? The second possibility from the medicine you take called methotrexate also. If you are exposed to pollens and dust, this may increase your problems. Okay.
Time. So, what's your diagnosis and differential diagnosis? I give you 1 minute more as compensation.
My differential diagnosis for this is maybe a case of bronchoalveolitis obliterans. Also maybe methotrexate inducing lung fibrosis. Also maybe asthma, but against this there is no precipitating factors for this asthma. Also maybe cardiac cause, but against this no orthopnea or paroxysmal nocturnal dyspnea or leg swelling. Maybe gastroesophageal reflux, but the patient has no heartburn or choking. I also think about renal impairment and amyloidosis, but no froth urine or a change in the amount of urine. I think in anemia, secondary to painkillers, but the tiredness and easy fatigability is not obvious in this patient. This was the differential diagnosis I bought for this case.
Why did you bought? bronchiolitis obliterans as a first differential, and the patient don't complain of noisy chest.
I asked him about the noisy chest, but no noisy chest. And this is against bronchiolitis obliterans. But no other causes I can put for this. Maybe methotrexate and lung fibrosis also.
Okay. So this condition may be related to your disease itself, rheumatoid arthritis, or may be related to the treatment you are receiving, methotrexate. But you replied the patient that most probably this shortness of breath and the cough related to your condition. And you didn't mention methotrexate as a cause. And this is a defect in the reply of the concern. Okay.
I tell him in the last of the discussion.
How to differentiate between, yes, what methotrexate can cause for this patient?
Methotrexate can cause for this patient pulmonary, can induce pulmonary fibrosis.
Yes, what's called hypersensitive pneumonitis. Okay, how can you differentiate between bronchiolitis obliterans and lung fibrosis due to methotrexate with one test only?
One test only?
Yes.
From the chest X-ray?
Yes, what the chest X-ray will show on both.
In pulmonary fibrosis, it will show lower pulmonary fibrosis. In bronchiolitis obliterans, I think this will be in the apical or the middle part, but I am not sure about this.
Yeah, what about the pattern of is it obstructive and restrictive pattern? Which of them is obstructive and the other is restrictive?
By pulmonary function test.
Yes, so pulmonary function test will differentiate between both. In bronchiolitis obliterans, it will be obstructive pattern, and methotrexate-induced fibrosis, it would be restrictive pattern.
Restrictive.
Okay, what the rheumatoid arthritis can cause in the lung? What the lung pathology in rheumatoid arthritis can induce?
It can cause rheumatoid nodule, can cause pleural effusion, and can be also cause pulmonary fibrosis.
What else?
Also bronchiolitis obliterans.
Yes, what else?
Bilirubin.
And?
Vascular, pulmonary hypertension.
Secondary pulmonary hypertension. Yes, is this one of the causes also and one of the differential diagnosis of our case, secondary pulmonary hypertension, which can cause shortness of breath and cough
against
also.
This, yes, but against this, there is no ankle swelling.
Yes, this is according to the limits of secondary pulmonary hypertension and the wedge pressure of the pulmonary wedge pressure. Okay, and it will not be the first and our differential. So you will put which one of these as first differential?
I think methotrexate induced pulmonary fibrosis may be put in the first of differential now.
Okay, so and if the patient asked you are going to stop this medication for me, doctor?
I will make a multidisciplinary team, including his the physician treating his rheumatoid, and the chest physician, and the internist, and the social worker, And according to and we will discuss this. And according the management plan put by the multidisciplinary team, we will inform him. If they found that this medicine should be stopped, we will stop. But I think should be stopped this medicine. But this is after the decision of multidisciplinary team. This is not my decision.
Yes, you are not the one. You are not the one to decide to stop the medication. It's according to multidisciplinary team from rheumatology doctor and chest physician by outweighing the risk versus the benefit. And according to that, they will take the decision of stopping the treatment or to continue the treatment. Okay, thank you, Dr. Muhammad.
Thank you, Dr. Saad. ايه الأخبار؟
Open discussion about the case. We'll do open discussion and we'll see. Any comments? Dr. Yasser?
Dr. Saad, actually I didn't attend from the start, but I think Dr. Fathallah did well, Dr. Muhammad. But I didn't hear about the relation between temporal relationship between the starting of this medication with cough, if it is related or not related. If not related, most likely the diagnosis will be pulmonary fibrosis. As you tell us before, there is the rheumatoid arthritis can affect the lung. We can start from the pleura, as Dr. Muhammad said, pleurisy, pleural effusion, and pneumothorax, and taking the lung, causing pulmonary fibrosis, rheumatoid nodule, and vasculature, pulmonary hypertension. And as you tell him, pulmonary hypertension can cause cough and shortness of breath without not ankle swelling. Ankle swelling coming with heart failure, with right-sided heart failure. I think this is according to temporal relationship between the medication. If the medication started after the shortness of breathing and the cough, most likely related to rheumatoid itself, not to the medication. So I think if you put methotrexate, if related, in the first differential, second differential will be pulmonary fibrosis due to rheumatoid itself, and also, as you tell him, maybe secondary pulmonary hypertension related to rheumatoid.
Okay, actually the methotrexate started 2 years back, and the cough and shortness of breath started 2 months back.
2 months only.
So
yeah.
The 2 months, yes, but it can after a time of methotrexate treatment, it can cause lung fibrosis, or what's called pneumonitis, hypersensitive pneumonitis after a time of methotrexate. So we don't have to put the relationship between the time of treatment and the appearance of the symptoms. Even in cough related to ACE inhibitor, ACE inhibitor can be taken for years, and then dry cough can develop after ACE inhibitor, after years of ACE inhibitor consumption.
Yeah, Dr. Sadiq, this is a different lapse of time between the start of the side effect and the medication. I mean, if this shortness of breath started before starting methotrexate. So I think if it started before, yeah.
Yeah, I agree with you then. I get your point, Dr. Yasser.
Okay, Dr. Sadak, I have one question. If for rheumatoid lung, suppose because of rheumatoid arthritis, patient develops fibrosis, like basal pulmonary fibrosis, then how you will differentiate? It is because of drug or because of rheumatoid arthritis?
You mean if it is lung fibrosis because of methotrexate, or because of the disease itself?
Yes, because of disease itself. No, I mean patient on methotrexate and fibrosis can be because of disease itself and because of drug as well. So, is there any way we can
Yeah.
differentiate?
I think pulmonary bronchial lavage, Dr. Rapish, I think it can differentiate in lung fibrosis. There will be lymphocytosis in the bronchial lavage, but in methotrexate there will not be this lymphocytosis. I'm not sure about this actually, but this is my reply. I'm not sure about it.
Yeah, Dr. Sadiq, the differentiation between this pulmonary fibrosis either due to rheumatoid arthritis or the methotrexate, it is not clinical. This is history, from the history, yeah, mainly from the history, because it in the clinical symptoms and signs, and also in the imaging, the same. The picture will be the same. So the history is the main issue in this differentiation.
Even the cytology, Dr. Yasser?
Yes, cytology, it will come lymphocytosis embossed with eosinophils.
Okay.
Because both of this pneumonitis, hypersensitive pneumonitis, this is the mechanism is
Yes,
the same.
hypersensitive pneumonitis. And both of them also will be in the base of the lung. Lung fibrosis is the base of the lung in rheumatoid, and drug-induced pulmonary fibrosis also both are in the base of the lung. Okay, next case was Dr. Yasser, and the third case was Dr. Bijay.
Okay.
Okay, Dr. Yasser, communication skills. Mrs. Marwa is 27 years old. She has been complaining of weight gain and tiredness for the last 2 months. Thyroid function test done for her and confirmed that she has hypothyroidism. You are senior house officer of the medical department, and your role to explain the diagnosis for Mrs. Marwa and the further plan of management and any concerns she has. Dr. Khalid, if you are just joined us, you can mute the cam from the ring blue, and then I repeat the scenario again. Mrs. Marwa is 27 years old. She has been complaining of tiredness and weight gain for the last 2 months. Thyroid function test done for her and confirmed that she has hypothyroidism. You are senior house officer of the medical department, and your role is to explain to Mrs. Marwa the diagnosis and the further plan of management and any concerns she has. Okay, Dr. Yassin? Ready?
Yes, Dr. Shah. Yes. Good evening, Mrs. Marwa.
Good evening, doctor.
I am Dr. Yasser, Senior House Officer in Medical Clinic today. Happy to see you.
Nice to see you, doctor.
Yeah. Mrs. Marwa, can I ask you if you have anyone to attend this meeting together with you?
No, it's okay, doctor. I can manage myself.
Yeah. Actually, Mrs. Marwa, I have been informed you are complaining of weight gain and tiredness for the last 2 months, and you do blood test for this. What do you expect from this blood test? You have any expectation?
Yes, doctor, maybe I have some anemia. That's why I have this tiredness.
Yeah. You didn't inform by the consultant in the last meeting about your diagnosis or any doctors before?
No, doctor, they just told me that they are going to do for me some blood tests for further investigation for my condition.
Yeah. Actually, Mrs. Marwa, the blood test result coming today, and I am sorry the result's not good as we hope.
Is it something serious, doctor?
Actually, it is serious, but it can be treated and controlled if you take the treatment and compliant with the treatment. This is a good thing in this problem. So you have what's called hypothyroidism. Do you know about this or hear about this before?
No, never, doctor.
Yeah. You want me to explain more or more details about this?
Yes, please, doctor. Please.
Yeah. Actually, Mrs. Marwa, there is one of gland in the front of the neck called thyroid gland. Actually, this thyroid gland secrete important of the function of the cells in the body, what's called the metabolism. It's control our blood pressure, control blood sugar, control what's called metabolism in the body. So actually in this condition, this protein is decreased. The production of this protein decreased, Mrs. Marwa. You are following me?
And what could be the cause, doctor?
Actually, we have multiple causes for this. Sometimes problems in the immune system causing what's called Hashimoto's thyroiditis, and there is also problems related to one of the nutrients called iodine, deficient in this nutrient, or sometimes related to some surgery before. You have any history of surgery?
No, doctor.
Yeah. You have this problem only 2 months, not before?
Yes, doctor.
Yeah. Actually, we have multiple causes. Also can be caused by drugs. You have any drugs? Any drug list?
No, never, doctor.
Yeah. What's called drugs like what's called amiodarone can cause this. So now we will investigate for this, and the most important thing to give the treatment. And actually, you want to explain more about the symptoms of this decrease in this protein causing your weight gain and tiredness. Also can causing dryness in your skin, can cause problems in your menstrual cycle. You have any problems with your menstrual cycle?
Yes, doctor, it is irregular and it is heavy, doctor.
Yeah, I'm sorry for this. Also can cause problems in feeling of cold most of the time. Yeah, and causing drying in your skin and also drying in your hair. So Actually, this is serious problem if not treated and can cause problems for you. So the most important to start the treatment what's called thyroxine. We'll give what's called replacement therapy for this problem. You are following me, Mrs. Marwa?
Yes, doctor. Is there
Yeah.
any side effects of this thyroxine, doctor?
Actually, this is a replacement treatment. The side effects is very, very rare in this replacement treatment because we give the replacement. We give this protein which is deficient in your body. So it is unlikely to cause side effects for you. But if taken in too much,
Yes,
if taken tablet, too much tablet, it can cause this overactivity, causing shaking movement in your hand, causing sweating, causing heart awareness. Yeah, but we will make regular follow-up to avoid giving overdose or increase in your dose.
For how long I'm going to take this medication, doctor?
Actually, most likely will take long run if the cause, according to the cause, but most likely if still deficient, you will take for the long run and all your life, all your life. But there is some reversible causes. We will check for the causes, and if it is reversible, you can take only for this period of the short deficient in this protein. You have any pain in your neck?
No, doctor.
Yeah. Yeah, Ms. Marwa.
What if I missed
You
one
are
dose
following
of this
me now?
medication, doctor?
Yeah. Actually, if you miss the dose within 2 hours, you can take the dose, no problem. If you take late after 2 hours, no problem. But if more than 3 hours, you can miss this dose and can take the next dose without doubling the dose, without no problems.
Yes, doctor.
Yeah. So, you are agree with this treatment, Mrs. Marwa?
Yes, doctor, I have to agree to continue my life.
Yeah. Also, I want to tell you something. Also, this if this problem not treated can cause what's called myxedema coma, and this is serious condition can causing this you feel cold and causing your blood sugar is low, and also can affect your conscious level, Mrs. Marwa. So we need to be compliant with this medication because it is essential to avoid this problem from occurring because it is serious for your life.
Yes, doctor.
Yeah. You want to ask me anything, Mrs. Marwa?
Yes, doctor, it will affect my work, doctor.
Actually, this what's your job?
I'm working as a teacher, doctor.
Yeah.
You know, I'm very
I
active in
think
my
this-
job, and I'm doing a lot of journeys outside and trips outside with my children.
Yeah. Actually, Mrs. Marwa, this replacement treatment will help you, and you can live near normal life, Mrs. Marwa. But the most important to be compliant with the medication, to have this card with you for the follow-up. If you go to emergency for any causes, any doctor to be aware of this.
Yes, doctor.
Yeah, Mrs. Marwa, let us to summarize what we discussed today.
Yes.
Yeah, Mrs. Marwa, you are complaining of, you are 27-year-old, complaining of increase in your weight associated with tiredness for the last 2 months. And we do blood test, and the result showing you have what's called hypothyroidism deficient in thyroxine hormone or from the gland in front of your neck, and this is causing your symptoms and more other symptoms like dryness in your skin and drying in your hair, thinning in your hair, and problems in your menstrual cycle, and also in problems in your mood. Can you tell me? Yeah. And we are planning to give you the replacement treatment, and you will have follow-up in our clinic most likely after 2 to 3 months, and later we can make after controlling we'll control this according to what's called TSH, another protein, another hormone secreted from the master gland in the back of your nose in the brain. And after that you can follow up annually, yearly. Yeah. So can I ask what's about your mood, Mrs. Marwa?
2 minutes remaining. Yes, doctor, I have very bad mood recently, doctor. I feel so depressed.
Yeah. Yeah, but life is still precious for you?
Yes, doctor.
Yeah. So you after this summary, you won't add anything, ask anything, Mrs. Marwa?
No, doctor, thank you for that.
Yeah. So can you tell me what's your concern?
Yes, doctor, you replied already. My concern is I appreciate that.
Yeah. You have any? Can I ask you have any heart disease? History of heart disease?
No, doctor.
You are married?
Yes, doctor, I'm married.
You are planning to be pregnant? You have any kids?
يا راجل يا راجل يعني MBA time out يعني. Yes, doctor, I have one kid, but
we have still 2 minutes.
Yes, doctor, I have one kid. Yeah, he's 2 years old now, and we are planning to have a kid also still in the future.
Yeah. Yeah, I think I want to tell you something. In the dose of this replacement therapy thyroxine maybe need to be increased, will need to be increased during pregnancy, maybe 50%, and after the pregnant end of after the delivery, it can be coming to the normal, and this is according to the follow-up in our clinic.
Why, doctor? Does it carry any risk for me or for my baby?
Because you know this during pregnancy there is increase in the amount of energy because you are two, you and your infant, so need more energy. So this is responsible for what's called metabolism, and this is energy also. So this is the source of energy.
Yes.
So the requirement will be increased during pregnancy.
Yes, doctor.
Yeah. So, still we have time.
$30 seconds.
We have time. Do you smoke?
30 seconds.
Do you smoke?
No, doctor, I don't smoke.
You drink alcohol?
No.
Allah, you are very polite. Thank you very much. So I will give you a leaflet for the disease. I will give you a leaflet about the disease, and I will give you my contact number. You can call me at any time if you have any questions or query. Thank you, Mrs. Marwa.
Thank you, doctor, so much. The most important thing in this station, you made it in the last of the station. I will be so sad if you didn't mention pregnancy in this station, Dr. Yasser. And I'm sad also that you mentioned the athlete in the station, because it's very important.
أن تأتي متأخرا خيرا من ألا تأتي.
صحيح.
المشكلة أن
صحيح. لما تأتي بدري وخلاص يعني. Okay. Open discussion about the case. Dr. Fathala, your voice is interrupted so much.
Hello?
Yes.
Dr. Sadiq.
Okay, open discussion about the case.
Hello?
Yes, Dr. Fathala. Yes.
هو يعني دكتور ياسر did the case very well, but he take a long time to ask here about the etiology, and this is not needed in this station. يعني if he tell just a hint, this is not a history. He take a lot of history during the communication, but I answer all the concern well. He instruct. He should talk more. يعني this is all our fault. When we make a counseling at any disease, we start to read from the book. The patient don't need rush of information. He just needs a hint. What is this problem? What is this? If this problem is not treated well, this will be the complication 1, 2, 3, 4. And what will be the management plan? In the management plan, I think he forget to refer her to the endocrine. I am not sure he tell about that the gland. He will refer her to a gland or not.
Yeah.
Hello?
He didn't tell here about referral for gland doctor and the follow-up in the outpatient clinic, and the thyroid function test to be done for her every 3 to 4 months to be sure that her thyroid function within normal range. And after that, it can be once yearly. 3 to 4 months, and after that, once yearly. Yeah.
But
regarding
this meet after 4 to 6 weeks, if it is recent.
Yes, regarding pregnancy, also I think Dr. Yasser, he didn't focus on pregnancy in proper way. In pregnancy is very important to mention this case early in the case. If she is married or not, and if she is planning for children in the future, because her disease can affect her pregnancy and her baby. And you have to mention for her how to affect her pregnancy and her baby. It can make preterm labor, or maybe complication of her pregnancy, or maybe a loss of weight, or decreased weight of her baby. So that if she is planning for pregnancy, she has to inform her gland doctor about that, to increase the dose of thyroxine by 50%, because the requirement of thyroxine will be increased during pregnancy, and to avoid complication of hypothyroidism in pregnancy.
Also, he go direct to myxedema coma. This is very important, but he missed the complication. The thyroid has effect on the muscle. It causes proximal myopathy. It causes peripheral neuropathy. It causes heart disease because of the high cholesterol. If you want to make any female,
he asked about
push her to take
he asked about if she has cardiac disease. But he has to mention the complication of hypothyroidism. All the complications.
If you want to push any female to take thyroxine, just tell her your hair will fall if you don't take the medicine. She will take it immediately.
It's a good idea. But you have to mention all the complications of hypothyroidism. Dr. Yasser already covered most of the complications of hypothyroidism. And it's very important to mention about myxedema coma, which is a life-threatening condition if she didn't take medication in time and she was not adherent to her medication. But we can avoid all of these complications if she is completely compliant on her thyroxine and taking thyroxine on time and regular in appointment. And she's regular in her outpatient appointment to measure her thyroid function to be within normal range. Dr. Yasser replied, yes.
One question, what about if surrogate asked, is it curable disease?
I asked him already for how long I'm going to take this medication. Most of the cases of your condition, of this condition, have to take the medication for all life, all over life. Some cases can be transient, but most of the cases, because of the disturbance of immune system, so that medication has to be taken for life. Is it curable condition or not? It is the same answer. Most of the cases are not curable because it is due to deficiency, disturbance of your immune system, which is long life, so that treatment has to be given for life. Some cases can be due to, like Dr. Yasser said, iodine deficiency, can be due to postpartum thyroiditis, which is transient, can be due to subacute thyroiditis, but most of the cases are autoimmune and treatment has to be given for life. Again, don't forget pregnancy and hypothyroidism. Very important to focus on pregnancy, and that she has to take medication. She has to tell her gland doctor about planning for pregnancy to increase the dose of thyroxine for her, because, and they tell her about the complication of hypothyroidism in pregnancy. It can affect her pregnancy in the form of preterm labor or stillbirth pairs or placenta previa, or maybe severe hemorrhage after delivery, or maybe decreased weight of the fetus. So that she has to tell the gland doctor about planning to be pregnant before planning. Okay, next case, Dr. BJ.
Yes.
History taking.
Okay.
Mrs. Hind is 32 years old. I'm sorry. Mrs. Hind is 46 years old. She has been complaining of fracture of her right wrist, of the fracture in the wrist joint. And this is a second attack of fracture for her. She had fracture of the left wrist 2 months back. DEXA scan done for her and confirmed that she has osteoporosis. You are senior officer of the medical department, and you rule to talk to Mrs. Hind about her condition and the risk factors, underlying risk factors for her condition.
So how old is the patient?
The patient is 47 years old.
Should we start now?
Okay.
Okay. Good morning. I am Dr. Jha in SHO and Medical Department. You are Mrs. Hind, 46 years old, right?
Yes, doctor.
Nice to meet you, Mrs. Hind. How are you?
I'm okay, doctor, but I feel unwell after my second fracture of my right wrist, doctor.
Right. Sorry to hear that. I am here to find out what the possible reason could be and why you are suffering for this. So, can you tell me what is going on altogether on your health issue, apart from this fracture? What is there?
Nothing at all, doctor. I'm completely well. I'm a swimmer trainer, and I live my life in normal way. I just had this fracture of my right wrist recently, 1 week back, and also I had this fracture of my left wrist 2 months back, doctor.
And
Otherwise, I'm okay, doctor.
Okay. And how this fracture happens? Did you fall? Was there any injury?
Yes, doctor, it happened after falling down.
Right. So, both the occasions you fall down and then there was fracture.
Yes, doctor.
Okay. And this, some investigation they did by your doctor, and it says that you have bone thinning. Are you aware of that?
Yes, doctor, my consultant told me yesterday about this result. He told me that I have fragile bone, but I don't know why, doctor.
Okay. So, right. So I will ask you a few sorts of questions just to find out what are the possibilities and why you are having thin bone. Can you tell me, have you recently lost any weight?
No, doctor.
Or have you gained some weight in the past few months or year? Is there any change?
Yes, I gained some weight, doctor, but not a lot of weight. It is just 5 kilograms. Because maybe I don't practice swimming so much recently.
Right. So you were practicing swimming before?
Yes, doctor, I'm a swimming trainer, doctor.
Fine, that's fine. So this 5 kilo weight put on duration is what? How many months?
I'm not sure about that, doctor. Maybe in the last 2 years.
Okay. Apart from that, do you have any other symptoms? Do you have, and are you suffering from anything?
Any symptoms like what, doctor?
I mean, anything you are suffering from?
No, I don't have any medical illness at all, doctor.
Okay. Any joints pain?
No, doctor.
Okay. Any previous history of diabetes or blood pressure? Do you take any medication for that?
Never, doctor.
Okay. How is your diet? Do you take healthy diet, good nutritionist diet?
Yes, my diet is balanced diet, doctor.
Okay. Have you noticed any change in your hair fall, or any change in the nails?
No.
Okay. Right. What about, I will ask you some personal question if you don't mind. Are you still having periods?
No, doctor.
And when it has stopped?
It stopped when I was 42, doctor.
Right. After that, did it develop any uneasiness, any flushing, or do you seek any advice for that, or anything happens?
Yes, doctor, I have sometimes flushing, and I seek the medical care for my GP. He told me this is normal for my age.
Okay. So, you didn't take any drugs for that? Any treatment given to you?
No. No, doctor.
Right. What about in your family? Your parents, siblings, they do have any same condition like you?
No, doctor. I don't remember anyone have the same complaint.
Any disease runs in your family?
Yes, my mother is diabetic, and my father died already.
Okay. Right. In previous, do you have any time gland problem? Anybody told you any gland problem?
No, doctor.
So in this past, have you admitted in hospital or seek any medical advice?
No.
Do you take any drugs, any medicine?
No.
What about your smoking? Do you smoke?
Yes, I smoke, doctor. 20 cigarettes per day.
Since how long?
For the last 10 years, doctor.
Okay. And what about your alcohol? Do you take alcohol as well?
Yes, doctor, I drink alcohol.
How much you need?
Maybe 1 to 2 glasses per day, doctor.
And weekend, do you drink more?
No, I'm regular in such this amount, 1 to 2 glasses per day.
Okay. So you are aware of the unit recommended for you. You are within that, or you are taking more?
Excuse me, doctor?
The recommended unit, you are within that, or you are taking more?
No, I'm not taking more, doctor.
Fine. Okay. Any illicit drug you are taking? Any mood elevating drug?
No, doctor.
Have you been undergone any operation before?
No.
Okay, Ms. Hind, bit question, maybe not related you feel, but I will ask that everything is all right in your general health. So, just to, do you have ever headache?
No.
Any funny turns?
No.
Any problem in your eyes or ears?
No.
Any mouth ulcer?
No.
Any cough?
No.
Do you ever get short of breath?
No.
Any racing of heart?
No.
Ever felt weakness in your limbs?
No.
Any pin and needles in the limbs?
No.
Any tummy pain?
No, doctor.
How is your water work?
It's okay, doctor.
And how is your bowel habit?
It's okay also, doctor.
Okay. And any rashes do you have ever in the hand, in the skin, on the legs or anywhere?
No skin rash, doctor.
Okay. So, Mrs. Hind, the story so far, what you told me, they have done some investigation and we will ask to do some more investigation to find out the cause why we are having this thinning of bone. That is what it seems. So, would you like here to ask me any question and do you have any concern which I should address first?
Yes, doctor. Regarding this disease, I'm working as a swimming trainer. So I'd like to know the effect of the disease on my job. Have I continued my job, doctor, or have I stopped it because it may be dangerous for my condition?
No, I think swimming will help in the sense that you are doing some exercise. This will help you if you will doing exercise for a quite long time and then you get stop it. Lack of exercise itself may precipitate, this thinning of bone. So if you have
yes,
active
doctor,
life,
but the consultant told me that my bone is fragile and it can be easily fractured if I'm exposed to any trauma, or maybe minor trauma can be cause fracture to my bones.
yes, that we will do some assessment how thin it is, and there are treatment. With that, we can help you to regain the strength in the bone. There are treatment, and it is a treatable condition. And I think with this, the age you are in right now, and this treatment which we will offer to you, along with a bit of active lifestyle, will help you to come over this problem. So, before that, giving treatment, we will
so
do
I have to continue. I can continue my job, doctor.
Yes, I think so. But before that, I will try to find out what treatment is needed for you after getting the full diagnosis, why you are having this, and then we can treat this condition. So till we are finding the diagnosis,
what could be the cause of my condition?
Yes, there are various causes, from simple cause like starts from poor nutrition to some serious causes, maybe lack of sun exposure or lack of activity, some glands problems, and there are various causes. We have to find out by doing some blood test, and we will do some imaginary scanning of your bone as well. Then we will make sure that we can treat this condition.
Yes, sir.
So, Ms. Hind, just to sum up what you are having, that you got 2 fractures in 2-month interval, and the latest one is 1 week before, and both was in the wrist, which you got when you got impacted with the fall, and you have been diagnosed by your consultant before that you have thin bone and it is getting fragile with minimal trauma. Apart from this, anything you would like to add that which I didn't ask you?
No, doctor.
Fine, Ms. Hind. So, we will meet again after doing the blood investigation and some imaging, and there I will tell you what treatment we can offer, and we will try to diagnose and give you good treatment so that you will improve. Is that okay?
Yes, doctor.
Okay. Thank you.
Thank you. So, what's your diagnosis?
Diagnosis is there already osteoporosis. We have to find out the cause. So some investigation has to be done to make it sure why it is this.
From the history, what could be the cause?
Could be the early menopause, lack of sun exposure.
Did you ask about the sun exposure?
Yes.
You didn't ask about sun exposure.
Sun exposure, I didn't that? Okay.
Okay. What else could be the cause, underlying cause?
Yes, underlying another possibility is that some thyrotoxicosis, smoking.
Did you ask about hyperthyroid symptoms?
No, I don't think so.
Okay. What else?
Smoking can itself one cause.
Yes.
Then
can be a risk
she
factor.
don't have but oophorectomy like operation, corticosteroid use.
Yeah, did you ask about steroid by name?
No, but she told me no drug taking.
Yeah, you asked about the drug list of the patient, but you didn't specify the name of the steroids.
Okay.
Okay. What else?
Then poor nutrition can be one of the cause. HRT, oral contraceptive pills, collagen vascular, some connective tissue disorder, rheumatoid arthritis, SLE, scleroderma, or some connective tissue disorder.
Oral contraceptive pills can be a cause?
But in this case, no.
No, it is not a cause. Okay. Okay, what investigation you are going to do for the patient?
We'll start doing with the basic investigation, blood test like CBC, LFT, RFT, electrolytes, X-ray of the spine, some DEXA spine, isotope bone scan, and apart from that, we will do thyroid function test as well, hormonal assessment, LH, FSH, estrogen, and thyroid function test we will do.
Vitamin D3, calcium?
Yes, bone profile, we can do calcium, alkaline phosphatase, and phosphorus.
Yeah.
Bone markers, calcium, phosphorus, and alkaline phosphatase. Then routine investigation to find out if there is some problem she is having which can cause this problem, like ultrasound abdomen, CT scan if required. Maybe having some primary or what.
Okay, but don't push a lot of investigation which is not required for the patient. Just you have to ask for investigation in the circle of the history, in the positive data of the history. So CT scan, why CT scan? This will be a wasting. Okay. Thank you, Dr. Bija.
Thank you.
Open discussion.
Can we consider cancer also?
Cancer? Did you ask about any history of loss of weight? There is no history of loss of weight. There is history of weight gain. So
yes,
I think to put cancer at the differential, he will. This will not impress the examiner.
Doctor, I think there is something here.
Yes.
Hello? Yes,
Who's talking?
the endocrinal causes here. Yes, I'm Dr. Khaled.
Yes, Dr. Khaled.
Hello? Oh, yes.
Yes.
Here, yes, history of weight gain, maybe the endocrinal condition here play an important role. So I don't hear the history well, but Cushing syndrome and hypothyroidism is an important items we have to ask about them because they can play a role here. So some tests about Cushing syndrome and hypothyroidism, like I mentioned, is important here. Yes, as you mentioned, the history of or asking about items which is rich with calcium and vitamin D, and as you say, exposure to vitamin sun is very important here. That's what I want to say here. Thank you.
Thank you, Dr. Khaled.
Thank you.
So this is a different case in history, and the scenario is different because the patient is diagnosed already, and he's checking up how much you will check for the risk factors for osteoporosis for the patient. So after going to the station, you will write your risk factors before going to the station. Risk factors will be in the form of lifestyle, okay, exercise, smoking, alcohol, exposure to sun. Then the most important for us is post-menopausal. So we have to ask about the last menstrual cycle, and we have to ask about the symptoms of post-menopausal symptoms: flushing, bad mood, dryness, vaginal dryness, tender breasts, weight gain. You have to ask about all the post-menopausal symptoms to be sure that this condition may be related to hair post-menopausal. After that, endocrinal causes in the form of hyperthyroidism. So you have to ask about all the hyperthyroid symptoms. Checking of the hand, distressing of heartbeats, loose motions, tremors, anxiety, polyphagia, increased desire for eating. And the Cushing, you have to ask about Cushing symptoms in the form of weight gain, and if there is weight gain, you have to determine how much weight gain and for how long, and what about appetite of the patient, and where the patient is putting the weight in the body. And then to ask about other symptoms of Cushing, mouth sores, skin rash or skin changes, muscle weakness or difficulty of combing hair or getting up from a chair. About hypertension and TM related to Cushing also. Other endocrinal causes can be hypogonadism, but this is related more to the males. If there is hypogonadism, it can cause thinning of the bone. Hyperparathyroidism also, one of the endocrinal causes of osteoporosis. So you have to ask about hypercalcemia symptoms in the form of increased thirsty, constipation, bad mood, tummy pain. Then the diet is very important. You have to ask about the diet. Dr. PG asked about the diet already. Is it balanced diet? Is it rich in meat and eggs or not? Then to ask about all the other systemic review. show the examiner that you are asking about all the risk factors together. Then at the end, ask about all the systemic review for the patient, including CNS, cardiovascular, GIT, genitourinary, okay, musculoskeletal, social history with whom the patient is living with, and if she is married or not, who is supporting her, smoking history, alcohol history, if there is any recreational drugs alleviating her mood. And then don't forget never to ask about how much the symptoms impact her job and usually daily activities, to refer the patient to a social worker. Social history is very important, and referring to a social worker, occupational health care according to the case is very important. Then don't forget to ask about steroid, yes, steroid therapy, and ask steroid therapy by name. Over-counter drug like steroids, for example, or anti-epileptic treatment, also anti-epileptic, one of the factors causing osteoporosis. Then give positive data give summary of the positive data of the patient, like Dr. BG made, and then you have to ask about the concern of the patient, then explain the concern for most probably. Okay, don't make it open unless we didn't reach a diagnosis. In this patient, we reached a diagnosis of osteoporosis postmenopausal. So your symptoms of fragile bone, most probably due to postmenopausal symptoms. This is because of deficiency of the hormone, estrogen hormone, which is important in strengthening and fortifying the bone. So what we are going to do for you is to do for you further blood tests to exclude other diagnoses and to confirm our diagnosis, then to refer you to a specialized doctor to give you the proper plan of management. Regarding exercise or regarding swimming, swimming is acceptable, or swimming is preferred in your condition because it strengthens the muscle bulk and strengthens the bone density for your condition, but you have to avoid vigorous exercise like football and rugby, for example. But the swimming is advised in such this condition to strengthen the muscle power or the muscle bulk and the density of the bone. Okay, how could you treat this patient, Dr. BG?
Hormonal replacement therapy, if diagnosed like a menopausal, then, and osteoporosis, if it is diagnosed, confirmed by doing a DEXA bone scan that it is osteoporosis, then biphosphonate, calcium and vitamin D.
Yeah, what side effects of biphosphonate can cause for the patient?